we'll now have Natalya Baynham. She is a community nurse specialist in the immunisation team at MCDC.
So it's the yeah. I'd like to start by acknowledging the Noongar people as the traditional owners and custodians of the land on which we work, and pay my respects to elders both past and present. I'm talking today about MCDC's experience with providing catch-up plans for general practice. It's something that Metro Disease Control Units have done for many years for patients under the age of 20 and for splenectomy patients. In the past, this was all the requests for catch-up plans were via emails and faxes, often not including all the information that was needed. Name spelt wrong, no date of birth, lacking a lot of important information. So what we decided to do was introduce a form that the GP practices need to fill out, and in July 2023 we implemented a system using RedCap where they put in their requests for catch-up plans online. So this is just the header of it. It's quite extensive. The mandatory fields all need to be filled in: name, date of birth, whether or not people have Medicare, whether they've had vaccines overseas. If so, those vaccines, vaccine history can be attached to the online survey. There is also the opportunity within the form to mark whether there are any special circumstances for which the request is being made. Those then enable us to prioritise the requests we receive. So how many catch-up plans are we doing for general practice? The numbers for 2020 on there are very misleading because we didn't start actually putting them into the system until November 2020. Unfortunately, we don't have pre-pandemic numbers to be able to compare. As you can see, the numbers for 2023 have gone up a lot, mostly because of increased migration, as far as we can tell. All the figures on this slide and ones coming up are all for Q3 because we introduced the system in July, so it's easier to do them for a quarter for this year. So we're getting requests. In that quarter, we had requests from 95 different GP practices. Our top 10 frequent requesters were requesting anything between 7 and 18 requests in that period of time. Who are the catch-up requests for? Who are the clients? As you can see, although most have Medicare, a very large proportion of people who don't have Medicare, and 73% of them are people who have, or children who have had vaccines overseas. Very small percentage is medically at risk, and the 6% of the catch-up plans that we do for GP practice are for Aboriginal children, which, given that the majority of the kids we're getting requests for are overseas vaccines, you can tell that the Aboriginal catch-ups are a fairly substantial proportion of our non-overseas children. Just to be very clear, these are catch-up plans that are requested by GP practices and doesn't include all the catch-up plans that are done for the rich kids' home visits that you've been hearing about earlier on. There's a substantial number of catch-up plans done for those, but these are ones that are for the GP practices. Where are these kids coming from? 40-something different, 46 different countries. And anybody doing catch-ups in I know there are people here who are doing clinics will recognise these as the most common countries that we have people come from. When I asked our public health intelligence team for a list of the top 10 countries, they originally did include Australia, which shows something about how well the practice nurses entering the data are reading what's required. Why are catch-up plans requested? As you can see, these are where we've asked for special circumstances, and the childcare and pre-kindy children on here are the no jab, no play legislation kids that don't get as far as Janice's no jab, no play system. So this is where people are going to the GP because the childcare won't even let them enrol until they've actually got their immunisations caught up. The childcare, pre-kindy and school entry adds up to more than half of the reasons that we're getting requests. The school entry, a lot of the kids who are coming from overseas, as most people here would know, to enrol in school, you do not have to be up to date with your vaccines, but you do have to have an air record. If you don't have Medicare, you have to have somebody create that for you, and a lot of the practices won't do that until we've actually done a catch-up plan. So it is limiting people's ability to start school until we get those done. What are we doing to help with the catch-ups rather than them all coming to us? We do have a box they can tick on there to say whether or not the practice has attempted to prepare a catch-up plan. If they have and they attach it, we will prioritise those so that we can give good feedback to those practices and those nurses who are actually learning to do their own catch-up plans. I should note that there are many practices that do their own catch-up plans and we don't see them. We're also WAFA are encouraging more nurses to get their immunisation certificates and doing education for them. In conclusion, our REDCap system is allowing us not just to prioritise and keep control of our catch-ups, but also to analyse the data that comes in. And I would like to thank our public health intelligence team both for building the system that we use for the requests and for analysing the data for this presentation. Thank you.
Many of us in the room face your pain. One of the most complex things at the moment, and I think it's only become so much worse, is us being the conduit between the parent, the practice, and the thing we know as AIR, and the AIR rules, and the AIR due and overdue rules, and trying to get a parent get that accurately reflected onto AIR, and then have it continue to be actively reflected on AIR, because the due and overdue rules and the AIR staff and the AIR system is so complex. I don't know where we're going with it. I mean, I've been in the job a long time and it's just as confusing now as it ever has been. It's not getting any easier, and it puts our parents in a very difficult position, I think.
Yeah, well, when we prepare catch-up plans, our aim is to prepare a clinically appropriate catch-up plan, but we prepare our catch-up plan to suit AIR if necessary, and also we do a lot of our contact with the GP practices is actually telling them, in fact, this kit is up to date. It's just you need to contact AIR to get the dose numbers reordered, or you've entered this in wrong or whatever. So yes, I agree. There's a lot of a lot of dealing with the practices. We don't sort out air for them. We get the practices to do that. Yeah. Questions? No, good.
I saw that the red caps at the moment is primarily focused on GP practice. Moving forward into the next year, will there be an opportunity for pharmacies also to use that same info request
That
sheet?
is something that has not been considered at all. So I'll take that question back to MCDC. Oh, Anastasia's just put her hand up, so yeah.
I mean, it's a very quick response just to say.
Yeah.
That Hallie and I have had some conversations about that.
Right.
Nancy. So
Yeah.
we're thinking about it, but it hasn't been resolved.
Yeah. Cool.
Thank you, Natalya.